Fibromyalgia can be a frustrating and vexing diagnosis for a patient to have. Many patients experience resistance and plain disbelief from their healthcare providers when they describe their symptoms in this condition. Recently, there has been a shift in this attitude among providers. What is behind the shift? Stick around to find out. For many years, fibromyalgia patients have experienced difficulty receiving a diagnosis for their symptoms. Patients reported that providers simply did not believe that their symptoms were real, and they were told that their symptoms existed purely in their minds. One patient reported that he was instructed simply to take a tonic and to toughen up. This skepticism in some providers persists even today and has been aggravated by the lack of a gold standard diagnostic method for diagnosing fibromyalgia. This has resulted in a delay in the diagnosis for many patients with fibromyalgia. In some cases, this delay may be as long as 5 years, and while pursuing a diagnosis, patients may end up seeing, on average, 3.7 different healthcare providers before an accurate diagnosis is made. In the past few years, this skepticism has waned. One of the reasons for this waning is the results of research that has been done on specific molecules in the blood and the spinal cord fluid of patients suffering from fibromyalgia on molecules known as cytokines. Altered patterns in the cytokines measurable in the blood of patients with fibromyalgia have essentially provided concrete evidence of their disease, essentially eliminating the misconception that their symptoms exist purely in their minds. Fibromyalgia is a complex syndrome that is characterized by widespread pain for at least 3 months, and that is usually accompanied by other symptoms such as fatigue or brain fogging or sleep disturbances. It can also be associated with a variety of autoimmune and psychiatric conditions. Cytokines are molecules that are released from the immune and other cells in the body when these cells are stimulated. There is a variety of different stimuli that can stimulate immune cells to produce cytokines in the body, such as injury or infection, or mental stress, or physical stress. Cytokines can be broadly divided into inflammatory cytokines and anti-inflammatory cytokines. An example of inflammatory cytokines would be interleukin 1, or interleukin 6, or interleukin 8, or tumor necrosis factor alpha. Examples of anti-inflammatory cytokines would be interleukin 4, or interleukin 5, or interleukin 10. Cytokines control the inflammation that is seen in the area of infections or injuries in the body. Cytokines can also increase or decrease the sensitivity of the nerves in the body to painful stimuli, both in the extremities, the limbs, as well as in the brain. The results of studies done on cytokines in the blood of patients with fibromyalgia, however, have sometimes been contradictory, and this may be the result of the pulsatile nature, the intermittent nature of the release of cytokines into the blood of the body. It may also be a result of the fact that the pattern of release of cytokines in the body follows the normal rhythm, the circadian rhythm that exists in the body. Results of research done at the University of Illinois College of Medicine in Chicago has resulted in the development of a test that eliminates many of the problems that arise with measuring cytokines in the blood directly. The FMA test identifies unique patterns of the cytokines found in white blood cells of the immune system in the blood of patients with fibromyalgia. The test has been approved by the FDA and is reimbursed by several insurance companies in the US, including Medicare. Fibromyalgia is not a figment of the imagination. It is a very real condition with measurable changes in the body, and that can accumulate in certain families carrying specific pain-related genes. As always, I'd like to thank you for watching. Like, share, leave your comments in the box below, and subscribe to the channel to support the channel. Until the next video, stay healthy and stay safe.